jewel drops like a bomb. The jewel drops like a bomb. The battle is on.
Good afternoon, everybody. Thank you so much for tuning in to MedPop, the podcast specifically designed with you in mind to help you make better informed decisions about your healthcare and your health journey in general. So my name is Jason Rice, and I am your host, and I'm also your pharmacist. And I'm super excited to be here with you, and I'm glad that you decided to listen in. So hit like, hit share. Okay, that's always part of this YouTube process, all that kind of stuff. So make sure you do that and give us some good ratings. Okay, we deeply appreciate that. So packed agenda today for sure. All right, first part of this, I'm going to give a reasonable introduction to who I am and why I'm doing this. And we'll talk a little bit about the podcast, what to expect, what may be coming up soon. And then we're going to dive into the agenda. And today's main topic is medication errors and how they affect you and what you can do to prevent them from happening. Okay. There's a greater emphasis on you managing your own health journey now. The healthcare system, in my professional opinion, is absolutely wackadoo right now. Okay. It has gotten so complex and so convoluted that it's making it very difficult for patients, especially when they get up in their elder years. It really, really breaks my heart when I see a lot of our seniors struggle so much. And quite honestly, a lot of them don't have anyone to help them. And that really tugs at the heartstrings, and it bothers me a lot. Should bother you too. So anyway, we're going to go ahead and get started. Again, my name is Jason Rice, and I am your pharmacist. I've been a pharmacist for 26 long years. 26 long years. Actually, it doesn't seem that long. I can't believe it. It's gone by as fast as it has. I've been a healthcare provider for 33 years. So started back in 1992 as a pharmacy technician, and I went to the Ohio State University College of Pharmacy, graduated in 1999, became a staff pharmacist, then a clinical pharmacist, then an assistant director of pharmacy, then relocated to North Carolina, did a little stint in retail, Walgreens, if you will, took a job as the director of pharmacy at the local hospital there in Western North Carolina. And then that hospital bought a couple other hospitals and became its own little health system. And I was promoted to the system director of pharmacy level. So as you can tell by what I'm telling you, obviously, I climbed that ladder, if you will, that career ladder. And so I moved back to Florida, my wife and I, after we became empty nesters in 2020. Moved back to get out of that cold weather and no more shoveling snow, as many of you are experiencing now. Came back to my original hospital where I started and became a medication reconciliation pharmacist. And that's very interesting. Now, I had some experience with medication reconciliation because I helped develop the program back at the healthcare system that I worked for, but I wasn't down in the trenches. And so when I became a medication reconciliation pharmacist, that's when you're down in the trenches. You are up there face to face with the patient. You're getting their information, making sure it's put in the system properly so that no medication errors occur at the beginning. Okay. And when you get everything right at the beginning, there's less likely for problems to occur throughout the process. Okay. That's proven facts. All right. So it was really interesting journey for me, and I liked it a lot. But then the director of pharmacy position came available, and I applied for that, and I moved into that role, and that's where I currently reside. Now, I'm not going to mention names of the hospitals out of respect to those hospitals, but also I don't want to create any conflicts of interest, and I certainly don't want to create any scenarios that might be considered defamation of any type of character. And I say that because I'm going to be speaking the truth to you. There's a lot of things that go on behind the four walls of healthcare institutions you are not aware of, okay? And it's intentional because healthcare institutions want you to feel safe when you come to them, and you should feel safe when you come to them. And here's the thing, for the most part, you are. But unfortunately, human beings operate the systems, and whenever there's a human being involved in a process, there's always a margin of error. So we try to develop systems to where we can actually try to either eliminate all the error or at least reduce it. So that being said, that kind of summarizes where I'm at. One thing I want to show you, and this kind of ties to a little sore subject of mine, but you see all these internet jockeys out there that say they're healthcare providers and say they're pharmacists and quite frankly, guys, I don't give them a stitch of credibility. You know why? Because this. Okay, I've never seen one ever show you this. This is my license. This is my Florida pharmacist license. Okay. Now you might say, oh my gosh, I can't believe you've shown that information. This is public information. So depending on your state, you either go to their Department of Health or you go to their Board of Pharmacy and you perform what is called verify a license. And you could put that pharmacist name in there. You can make sure that they don't have any disciplinary action on file. If they did, you can actually see it. So here you can see this is my license number. It is clear and active, and there are no discipline issues at all. Okay, so there you go. There's my credibility. I'm here to help you because I care about you. I've been doing this a long time, and throughout my years of experience, the single most, I could say probably I would say I'm most passionate about is medication and patient safety. It's always bothered me when I've seen unintended harm occur because I know in my heart it shouldn't have happened. Okay. What's even more bothersome is when nothing gets done about it to improve it. And guys, I hate to tell you this, but these things happen in our healthcare institutions every single day, even in the top names you all know and recognize. All of them have medication errors. All of them have medical errors. Okay. To err is human. You got to remember that. All right. So before we go any further, I want to mention to you that today's podcast episode is brought to you by MyMedList. Okay. This is an internet-based, web-based application, subscriber-based platform where users can go create, maintain, and communicate their med list and health information across the continuum of care. If you wonder what that noise was, that is my German Shepherd. Okay, I have 3 of them and they are in here with me, and one of them may pop up here and there, but they always like to make funny noises. So just to let you know, that wasn't my stomach or anything like that. That was actually Samson back here. Okay, and they may pop up. So don't be startled if they do. This type of podcast is quite honestly the most laid back you'll ever see. And plus, you're getting a chance to see who I am. Okay, this is who I am. This is how I am. Anywhere you would ever meet me, you get the same guy. I don't look at certain individuals as being VIPs or deserving of special treatment or anything like that. I look at everybody the same. We all put our pants on the same way, one leg at a time, and we all bleed red. Okay? So you got somebody that has confidence, that you can trust, that is going to give you good, accurate, scientific-based information. So back to MyMedList. These guys are the best. And if you don't believe me, I think you should listen to the president himself.
Strongly suggest you use MyMedList to manage your medications. They are a fabulous company, a great company, one of the greatest I know. If you keep a list of your medications, you need to be using MyMedList. These guys are pharmacists, the medication experts, the best, the perfect professionals, ones you can trust and depend on, especially Jason Rice. He is the real deal. What a caring and compassionate pharmacist. The guy is fantastic. Go to mymedlist.net and subscribe immediately. Do it. You won't regret it.
There you have it, folks, right from the president himself. So isn't AI cool? I mean, there are so many things that you can do with AI now. And before any of you out there click off, sign off and say, guy's a conservative, crazy nut, listen, I would have made that same video if it was Obama president. Can you imagine how much fun I would have had with Joe Biden? Okay, you can imagine how much fun that video would have been. So guys, here's the deal. I don't bring politics into anything. There's no room for that, especially in healthcare. And if you've got any providers out there that treat you differently because of the way you believe or what religion you practice or what your politics are, guys, I'm telling you, they aren't worth a hoot and they shouldn't be practicing. Okay. I stand on that. I'm firm on that. Remember, we all bleed red. Okay. Healthcare providers should be providing the best care all the time, regardless of who you are. I don't care if you got some big fancy name and you fly in your own private jet, makes no difference to me. You're going to get the same care from me. Okay? Plain and simple. All right. So let's go ahead and dive into today's agenda. All right. And we are going to talk about medication reconciliation errors and our innovative solution. When I say our innovative solution, My Medlist is actually my company. Okay. So I have the confidence in it. And I can say that because I've looked at all the different channels, if you will, that contribute to the errors I've seen over the years. And I've tried to develop a solution to those, if you will. And it turns out it's actually a website, web application that can do this and does do this. Okay. It requires a little investment on your side. Sure, it does. Okay. But guess what? I made it extremely affordable. As a matter of fact, the business consultants that I've talked to said it's too cheap. You're not going to make any money. I'm like, listen, I don't want to make it to where it's unaffordable and people can't use it. What's the point of that? I can't help anybody if they can't afford the product. All right. So there you go. I priced it where it's very affordable. And there's two different subscription options, and I'm going to get into that, and I'll show you that there towards the end. But let's go ahead and jump into this. Medication reconciliation errors and our innovative solution. All right, so here's the agenda overview. First of all, we want to get a good understanding of what medication reconciliation errors are, the causes and consequences of those errors, and then what's our solution? All right, I just mentioned it to you, My Medlist. And then the impact and future directions of that company. Okay, it's a great company. You heard the president say himself, I mean, good night. What more proof do you need? All right, so we want to understand medication reconciliation errors. Here we go. So the definition, what is medication reconciliation? Well, the purpose of it is it ensures accurate and complete medication information is maintained during patient care transitions to prevent errors. So bottom line, medication reconciliation is taking the information you provide, reconciling it to whether it's a hospital electronic medical record, or even if it's a new physician office you go to. They're all going to be asking for the same information. They want to know what medications you take, what vitamins, what supplements, and what it becomes very difficult when you take a bunch of those things. When you take 5 or more medications, it's called polypharmacy. Okay. And greater than 38% of the population already suffer from it. And those percentages go up as the age goes up. So I've seen seniors taking over 30 some medications. I'm not kidding you. It is appalling. And actually, polypharmacy was supposed to be reduced over the years. Guess what? It hasn't been. If anything, it's increased. There's more and more and more prescriptions prescribed. Okay. Now, importance of documentation. Proper documentation helps avoid medication discrepancies and promotes patient safety. Remember, the goal is to prevent medication errors and unintended harm. So if you've got proper documentation right at the beginning, there's less likely errors are going to occur down the pipeline. Okay. These are facts, folks. All right. Common types of reconciliation errors. Well, there's a number of them. Okay. First one I got listed here is omissions, medication omissions. These errors occur when necessary medications are left out of the reconciliation process, risking patient health. So you come into the ER, you're already in a compromised condition. Can you remember everything you take? Can you even remember to bring your list? Can you remember your phone if it's on your phone? Okay. Do you understand where all the problems can come into play? So it starts right there. So there's errors with medication omissions. Very important. Very important. Duplications in prescriptions. Well, if a medication is omitted and the doctor prescribes another medication in that same class, and maybe that other medication you were taking has a long half-life, meaning it's still in your system. Then they prescribe another one, and it basically is additive effect. Okay. Maybe it bottoms out your blood pressure or something. Things happen like this all the time, guys. I'm telling you straight, these things happen and you don't know it because they don't talk about it. All they talk about is how safe their institutions are. And remember, I want you to feel safe when you go into the hospital or when you go into a new clinic or something, but you got to remember to err is human. So there's errors, potential for errors, okay? Dosing mistakes. Incorrect dosing leads to ineffective treatment or toxicity, highlighting the importance of accurate reconciliation. Remember, you need to have complete, up-to-date, accurate information in order to avoid things like dosing mistakes. Heaven forbid if the wrong strength gets put in, or you end up taking more than what you normally take at home. These are big deals and they happen. They happen every day across our country. Drug interactions. This is another section, and I'll highlight a little bit on this. So unidentified drug interactions can cause harmful side effects and complicate patient care. Sure, they can. Drug interactions are very important. Here's the thing that gets left off. Who checks drug vitamin supplement interactions? Your pharmacy? Not hearing anything. Hear any crickets? Just crickets. No, they're not checking those things. The only time a retail pharmacy checks those types of things is when a prescriber prescribes an over-the-counter vitamin or supplement and it gets processed as a prescription. And then that vitamin, when it's entered into their system, will be compared against the other medications that you take. And if there's any information in there, as far as showing interactions, it will display. But remember, the majority of your vitamins and supplements, they're bought over the counter. Nobody's checking those things. And if you think your doctor knows, I got news for you. They don't get a whole lot of education on that side of stuff, okay? They get a lot of education on prescribing medications, but when you get into nutrition and diet and vitamins and supplements and stuff, I hate to be the bearer of bad news. It's not what you think. Communication breakdowns. This is a big one. As a matter of fact, this contributes to 40% or more of the medication errors that occur. Miscommunication is the most common cause of medication errors. Let's look at the prevalence and statistics. Okay, I just mentioned that with the 40% deal. Medication errors and patient safety. So on average, this is a crazy statistic. On average, each hospitalized patient faces one medication error every day. You might think to yourself, well, good night. There would be so much harm. We'd hear about that. No, you wouldn't. Because remember, there's a lot of different types of medication errors. And the most common type of medication error is what is known as a timing error. So if you're in the hospital, let's say your blood pressure medication was due at 10 a.m., the nurse has an hour window to give that to you, meaning he or she has to give it to you by 11 a.m. Guess what? The patient down the hallway coded. They got to go down there and attend to that patient. It's a long code. Okay, 11 o'clock has passed. You still haven't got your blood pressure medication. He or she finally gets back, and now it is 11:30, and you finally get your blood pressure medication. Guess what? That is a timing error. Now, did it cause you harm? No, probably not. And most of those timing errors don't cause harm, but there are those exceptions that do. So, timing errors, they happen every day, all the time, and likely those are the contributing factors to that statistic. Now, the over 40% of the errors stem from inadequate reconciliation during transitions of care. Those are those communication gaps that I'm telling you about. These are the things that we can do something about, and that's where My Med List comes along. Okay, we'll get into that because it's crucial that you remember that. Approximately 20% of the medication errors lead to patient harm. Goodness, that's crazy. 20%. Okay. According to health experts, medication errors are the most frequently occurring yet preventable error. Here's a kicker, leading to 7,000 to 9,000 deaths each year. That's crazy, guys. That's crazy. 26.3% of outpatient charts had discrepancies in medication records. That means, in common sense terms, 26.3% of those outpatient charts were incorrect when it pertained to the medications that patients were taking. 26.3%. That's absurd. 38% discrepancy rate was found in newly hospitalized patients. Now, remember, that's in the beginning. That's likely coming through the emergency department. Okay. That's terrible. 38%. 25% of prescription drugs used at home were not recorded in hospital admission records. 25%. A quarter of what you take didn't get recorded properly. It's horrible, guys. I'm just telling you. And it happens, and you don't even know it. So you got to take measures to protect yourself, okay? We're going to get into that. Factors contributing to the errors. Well, there's human, there's system, there's communication. These are the major part of the categories. If you break these down, this is on the facility type side, okay? Clinician fatigue and human limitations. Staffing shortages are crazy right now. I've never seen such nursing shortages and nurses being stretched so thin. If you think that they have time to do an adequate medication reconciliation on you when you come into the hospital, I got news for you. It doesn't happen. They do the best that they can, but they do not have time to be calling pharmacies and doctors' offices and VA centers and all that to try to get all that information. It is nearly impossible for the nurses to do that. Now, which one are you? Oh, now he's snoring. That's Samson snoring. Lack of financial support to invest in robust pharmacy-led MedRec programs. Okay, this is a big deal. So last couple of years or so, some of the institutions decided to get pharmacy involved in MedRec, and that's proven to be very beneficial. However, that has become limited now because they realized it costs money, lots of money, especially if you have a pharmacist doing it. You're talking 6 figures for every pharmacist that does it. Does that make sense? So now they don't invest in those programs as much, which is really sad because they did make a difference. Because the pharmacist and pharmacy technicians, that's their specialty. They know the drugs better than anybody. If they see something that looks wonky or wacky, good chance it is. Okay, they recognize it. Nurses don't necessarily recognize that. Now, a lot of your well-trained, well-experienced nurses can and do, but your pharmacists are most likely going to pick up on that stuff much quicker. Patients often lack knowledge about their medications, leading to incomplete medication histories. Here, that goes back to when a patient comes in already in a compromised state of mind. Heaven forbid they come in, they got a UTI. A lot of times urinary tract infections, especially if you're elderly, it really, really, really messes with your cognition. They can't remember anything, okay? Let alone remembering to bring their list or their phone or however they keep it. MyMedList has a solution to this. Polypharmacy, we already spoke about that. Anytime you take 5 or more prescription medications, you fall into the category of polypharmacy. If you take 10 or more, it's super polypharmacy. Now, remember, these are prescribed medications. This doesn't include over-the-counter vitamins and supplements, herbals, homeopathics, nutraceuticals. Good night, guys. Okay, you see where I'm going with this. You got to have a solution that keeps track of all this stuff and is easy to edit and communicate. And MyMedList does that for you. Patient presenting condition may inhibit. I just spoke to that. Okay, UTI, not right in the head. Okay, it's a problem. Inaccurate medication lists, patients fail to keep current. Okay, that's a biggie too. Then you might have a list, but I've run into the situation. I'm saying, how long ago did you update this? Well, it's about 2 years old. And I look at some of the meds. I'm like, you still take this? No, I just haven't had a chance to scratch it off. Well, that's not good. Okay, that's just not good because you run the risk of that medication being put on your list in the hospital and being given to you. You get what I'm saying? It's not a good thing. All right. So this is continued. Now we're looking at the system issues. Now, here's something that hospitals introduced. I think they were required to introduce. It's called barcode med administration. And so these systems, okay, basically what they do is Doctor orders a medication, the order gets entered into the system, gets put on your electronic medication record in the hospital. Okay. You also have a patient armband that has a barcode. So, nurse pulls the medication that also has a barcode. So they scan your patient armband, they scan the medication, and the medication should match what's in that electronic medication administration record. If it does, you'll hear happy little beep, beep, beep. Everything's good to go. Okay. Well, here's the limitation. What if the information is wrong at the beginning? What if it's the wrong medication that was entered into the system? Barcode med administration is not going to pick that up. It's only scanning against what was put into the system. So if the wrong information is being put in at the beginning, this system is not going to help you. Okay? It's a big limiting factor. Now, what I will say in a positive note is that barcode med administration systems have likely prevented, and I'm going to say millions of potential medication errors because it's been in place for many, 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 many years now. Okay. So I would say millions of errors have been avoided as a result of the system. So this is a great system, but the information has to be right at the beginning. Another reason why you need MyMedList. Poor quality patient safety programs. Okay. Every hospital is supposed to have a patient quality safety program. And basically, those programs are to evaluate the errors that have occurred, look at the systems that are in place, and see where those gaps happened. Why did this error happen? And then take it to the next level and fix the systems. The problem is, again, time and money. A lot of institutions collect the data and they do nothing with it. Absolutely nothing with it. And you'll see the same errors occur over and over and over again. Folks, it happens. I've seen it for years, decades. And I'm the one bringing it to your attention because it's the truth and you have a right to know. Okay. Discharge medication reconciliation errors. So this one here, this deals with hospitals have what's called a medication formulary, if you will. So there's different classes of medications, like let's say ACE inhibitors, blood pressure medication, ACE inhibitors. So there's a number of different ACE inhibitors. Well, hospitals typically will pick one or two in that class, and then they will substitute that one or two for the ones you take at home. All right. Well, you can look at the statins, for example. Let's say you come in and you're on Lipitor or atorvastatin, and the hospital's formulary item is Crestor or Rosuvastatin. So they're going to look at your atorvastatin dose and determine what the equivalent Crestor dose is, and then change it. And now you're going to be taking Crestor or Rosuvastatin while you're in the hospital. Now, when you are getting ready for discharge, that is supposed to change. It's supposed to go back to what you were originally taking. Here's where errors happen. I've seen people get discharged on both statins. They didn't discontinue the one that the hospital used. They left Crestor or Rosuvastatin on the discharge medrec along with your atorvastatin. Okay, and thank goodness that pharmacists pick up on this stuff, but guess what? Sometimes they don't. Hate to tell you that. Sometimes these errors slip through the cracks. No central database for all patient medications, vitamins, supplements, and herbal remedies. Okay, these are facts right here. So any system that's out there is always going to be limited because you control your medication, vitamin, and supplement program. Now, you may not control your prescribed medications so much, okay? But you choose what vitamins you're going to take and what supplements you're going to take. You've heard of something new. It sounds good. You're going to try it. Well, these hospital and healthcare systems, they don't know that. They only know that when you present back to them. So they're not keeping those things up to date because they don't know. But guess who does? You do. And MyMedList allows you to control that and update that every time you have any kind of changes. And even better, once you make the changes, you can send it to all your providers. Huge, huge, huge benefit there. Failure to remove previous patient visit medication lists from the EMARs, or electronic medication administration records, leading to reordering of medications patients no longer take. Guys, this is crazy. Let's say you went to the hospital in 2023. They took your medication list, put it into the computer system. All right. 2 years later, you have an exacerbation of some kind. You got to go back to that same hospital. Guess what list they have on file? The one from 2023, right? So if you don't keep your records updated and you provide the updated information to them, there's a very good chance that they're going to continue what was on that 2023 list. And if you're no longer taking certain prescription medications and they prescribe them for you, continue them in the hospital, bad things can happen, folks. I've seen it. I've seen it. Okay. So this is really, really critical. And so My Med List helps you with this. All right, potential risks and harms to patients. Of course, adverse drug reactions. Medication errors may cause harmful drug reactions that threaten patient safety and recovery. Of course they do. Hospital risk. Errors often result in increased hospital stays, complicating patient treatment and outcome. Absolutely. You have a medication error occur or an adverse drug reaction as a result of a medication error, it can cause you to have to stay in the hospital longer. Guess what? You pay for that. It's extended length of stay. It's not your fault. You think they're going to let you stay a day or two in the hospital for free? It's not going to happen, folks. You're probably looking at 10 grand each day on average. On average. So mortality concerns. This is the biggie. This goes back to that 7,000 to 9,000 statistic. Actually, I think it's higher. Serious errors can lead to fatal consequences. Emphasizing critical need for process reliability. There you go. Process reliability. That's My Med List right there. Process reliability. Okay. Our solution. This is what My Med List is. Okay. And I think you're going to be happy when you see it. So here we go. This is the overview of our innovative solution. So it's an intuitive web-based platform. As I stated before, the solution features an easy-to-use web-based cloud storage platform designed to improve medication reconciliation processes effectively. Okay, so this is a picture of your patient portal. When you subscribe to My Med List, you get your own patient portal. And this is where you will create your medication list. You can set up appointments to have a consultation with the pharmacist, me, okay? And we are going to go over everything together. So you have that opportunity right here. There's also another feature called Archive Medication. So anytime you discontinue a medication off your list, it will go into this history section so that you can use that to reference, or your physician can use that to reference. Very, very big deal. Workflow optimization. Presenting a completely accurate, well-organized medication list greatly reduces the risk for medication errors in the healthcare setting, keeping you from unintended harm. That's the whole goal. We want to eliminate medication errors or prevent them from happening in the first place. Multi-solution platform. My Med List offers multiple medication management solutions to meet all your needs, all the while providing the layers of protection you deserve. So this is really cool. So this is the first screen that you would see when you subscribe. And from here, you can go ahead and create your medication list. How our solution addresses the key challenges. Well, first, improving data accuracy. Our solutions enhances data accuracy by reducing errors and ensuring reliable information for better outcomes. Hands down. Hands down. As long as you keep it updated, it's gold. Enhancing communication. My Med List facilitates clear and timely communication of your medication list, including all changes to each of your healthcare providers to ensure everyone has the same accurate information. This is huge. This is huge. So if you have more than one doctor, right away, you've got a great potential of communication error, okay? Because those guys and gals are supposed to communicate with one another. They are supposed to be on the same page and have the same information when it comes to your medication and treatment regimens. Guess what? They don't always do that. Some are very good about it. Others are completely abysmal. So what do? You're caught in the middle. My Med List gives you a solution to where when you make changes on your medication list, you can email those changes directly to all of your providers with a couple clicks. That's it. Couple clicks and you've got it done. The information presentation. My Med List provides a user-friendly electronic form to create your medication list. Your information is organized the exact way providers look for when reconciling your medications. This significantly reduces medication errors from occurring. So what does this mean? Well, I developed it based on all the different things that I've seen that contribute to errors. I've structured the medication list in a format that makes it very efficient to follow. And it's exactly how clinicians need to see the information. You've got your demographics section. You've got your medication allergies and adverse drug reaction section. You've got your pharmacy section, provider section, scheduled medications, as needed medications, vitamins and supplements section, and a temporary medication section. And I'll talk a little bit about that before we go. The technological advantage. My Med List offers and utilizes QR code technology to assist you in having real-time access to your medication list and information, eliminating the need to carry paper lists, remember those note cards, or discharge instructions, and the concern of forgetting your phone in the time of crisis. A lot of people take pictures of their med bottle and have it on their phone. You forget your phone, you're done. Okay, especially if you go to multiple pharmacies, because some pharmacies are cheaper. If you pay cash for an item, you're going to shop around, use GoodRx or whatever it may be. So this picture right here is an example. It's one of the two. You get two QR code cards from My Med List. So this is the front. This little QR code takes you directly to the website. This will have your picture on it. This is my sample patient, John Sniffs. Okay, he's got a big nose. That's why that's his name, John Sniffs. And this QR code is assigned to John. It's assigned directly to Mr. Sniffs. So when you scan this QR code, his medication list is going to come up. All right? It's going to come up exactly how it looks on your screen. So all that information is right there, ready for the clinician to see it. Here it is. This is what it looks like. It's beautiful. So organized, so well constructed. So here again, patient demographics, allergies and adverse drug reactions, pharmacies, providers, your scheduled medications, as needed medications, your vitamins and supplements, and then temporary prescriptions. Now, temporary prescriptions, this is an important section. No one offers this. Only My Med List offers this. If you go to, let's say, an urgent care, right? You got a respiratory infection, okay? You're hacking, coughing, it's miserable, and they prescribe a Z-Pak, azithromycin, 5 days, 2 tablets one day, and then 1 tablet the next 4 days. You get it? And then Robitussin with codeine for the cough. See, you're not going to be taking those forever. They are temporary prescriptions. But let's say on day 3, you really get sick, you really get bad, and you got to go to the hospital. Well, the hospital folks are going to want to know that you're currently taking Zithromax and the Robitussin with codeine. They're going to want to know that. But because those prescriptions aren't things you take all the time, there is a very small probability that you've added them to your list. With My Med List, you can put them in this section. And if you enter the date your last dose is going to be taken, 3 days later, My Med List will automatically remove them from your list and put them in your archive medication section. It is absolutely fantastic. It's an invaluable feature and no one else offers it, folks. Just My Med List. Again, I've thought through these things. I've seen the mistakes and I'm thinking, good night, what can I do about this one? Well, here's the solution. People need to know what medications you're currently on, even if they're temporary. And this last section is patient comments. So anything that's out of the ordinary or any information that's additional that you want your provider to know of, you can put it in that particular section. Okay, so it's really, really good. At the bottom, this is where your functional tabs. Remember, I was talking about being able to email your providers. If you have all of your providers listed and their email addresses entered appropriately, you can simply click email or Gmail, whichever your carrier wants you to use, right? You click that button and a predefined email is already created and is ready to send with the updated med list to every one of those providers as long as you have their email address entered into your med list. It is a phenomenal feature, and guess what? It keeps everybody on the same page. They're all supposed to communicate with one another, folks, and they don't do it. Some do a good job, okay? There's always exceptions to every rule, but I can tell you, it is not as many as you would think. This helps solve that. And you can also download it as a PDF, and you can do whatever you want with it, okay? Hospital can do that. They can print your medication list. I've seen people bring in their medication list. It's the only copy they had, and the hospital lost it. I cannot tell you the number of times I've seen that. I go back to the patient and I'm like, well, I brought my list of medications in, but nobody can find it. I'm like, oh, good night. Do you have another copy somewhere? No, that was my only copy. So these things happen, folks. But my med list, because it's in an electronic format, it's in the cloud, you always have access. Let's say you forgot your QR code. Maybe you forgot these guys, okay? Maybe you forgot Mr. Smith's card, right? Okay. You have a username and password to your portal, and in a time of crisis, give that username and password to your nurse. They can log in and see it directly. They have internet access at the hospital. They can go to mymedlist.net. They can log in under the members page, put your username and password in, and they can see exactly what they need to see. So, folks, it's a brilliant solution, and I'm telling you, it is so worth the investment, and the investment is very small when you see the price, okay? All right, impact and future directions. So, expected outcomes and measurable benefits. So, we want to, as MyMedList, the company, we want to see a reduction in medication errors. We want to see enhanced patient outcomes. We also want to improve patient satisfaction. And this will happen also on the healthcare institutional side when they can process things more efficiently and more completely. So remember, they have all that good information up front. Everything's complete and accurate. There's less likely for errors to occur throughout your stay. And then also decrease in healthcare costs. By reducing errors and improving outcomes, this significantly lowers overall healthcare expenses, not only for a hospital, but for you. If you don't have an extended length of stay because of some crazy medication error, it just saved you money. Like I said, probably 10 grand or more a day. And that's no joke. Okay, continuous improvements and next steps. All right, so we want to incorporate user feedback. This is MyMedList speaking, okay? So we're always open to suggestions. So the longer this is in place, the more folks might get used to it and say, hey, you know what, if you could add this feature and that feature, if there is some commonality between those recommendations, we will be glad to look at that and possibly implement some of those suggestions. We also want to monitor performance metrics, okay? I'd love to see if it's going to have an impact on readmissions. Okay, I'd love to see that. And then we want to update the solution continuously based on changes in technology. We always want to stay ahead of the game. It's tough to do. Technology changes so quickly, but we always want to stay in front of it if we can. So in conclusion, guys, risks of medication errors. Medication reconciliation errors can lead and do lead to serious health risks if not properly managed in the healthcare setting. Serious health risks include fatalities. Remember, 7,000 to 9,000 people every year. Innovative solution benefits. Our innovative solution enhances medication safety by improving accuracy and reducing reconciliation errors. Okay, and improved healthcare outcomes. Safer medication management helps achieve better health outcomes and patient care quality overall. So that's it. That's MyMedList in a nutshell. These are the current problems in the medication management system in healthcare institutions. These errors happen every single day in every healthcare institution, folks. They don't talk about it much. Matter of fact, what they do talk about is their safety ratings through companies, nonprofit companies like Leapfrog. You'll hear, we got a Leapfrog A+. Well, that's great. Okay. I would want to go to a facility that has an A+, but the things that I know, and people can debate this or argue this with me, some of those things that they use with Leapfrog are submitted information, which means you can cherry pick. You can cherry pick the good. So don't think that doesn't happen. But for the most part, I will say your healthcare institutions are safe. We need them. We need to be glad that they're there for us. But you still have to protect yourself because of the complexities that exist in healthcare today. These are absolute facts. So now we are going to take a look at the Fast Five. That is the top 5 points of today's presentation. And it is sponsored by Rejuvenate Mobile IV Hydration. Look at this gal. She is so freaking hot. Wow. Can you believe I just said that? Ask my wife. That's why. That's Sarah, my lovely, beautiful wife. Been married for, I think we're closing in on 34 years in June. Can you imagine? But yeah, she's my hottie. So Rejuvenate Mobile IV Hydration. They do wellness infusions, comprehensive vitamin infusions and injections. They have a great weight loss clinic. So there's personalized weight loss plans. They're tailored specifically to you and your goals. They practice integrative wellness and focus on your lifestyle management. They also offer great vitamin and wellness products that are third-party tested, truly third-party tested, and contain quality ingredients from quality sources. And so they focus on everyday lifestyle wellness. And last but not least, they offer laboratory services so you can get your labs drawn and evaluated. She is almost finished with her nurse practitioner degree. She's got 1 semester left, and she has other colleagues in her practice. And guys, I'll tell you what, they have a fantastic group down there. I think you will be more than impressed. So if you happen to live near the Northport, Florida area, okay, or it's within driving distance, take advantage of this. Go online and you'll see their hours there, and just make an appointment. Go down there and see them. On the other side of their clinic is a spa, Salt and Light, and we'll talk about them a little bit too. And it's a great experience. So they're fantastic, and Sarah will take very good care of you. And so the Fast Five, today's Fast Five, I'm in it for you. That's number 1. Guys, I care about you. That's why I'm doing this. I've been a pharmacist for 26 years. It's been good to me. You heard me say that pharmacists make about 6 figures. Okay. I've done well over the years. I'm not hurting. So I'm not doing this for the money. Now, I want you to like and click like and share, right? Isn't that what this little guy says? I think this is what this shows. Yeah. Like and subscribe. I want you to do that. Absolutely. Because I want you to spread the word, because this is going to help a lot of people. But it's not for the money. I priced it cheap. Remember, the business consultant said it's too cheap. So what? I'm here to help you. Our content is designed to help you make better informed decisions. That's point number 2. Point number 3, my aim is to help you gain control of your healthcare journey. I want you to remember that. And remember that when it comes to your providers, you hire them. It's not the other way around. You understand that? If they are not meeting your needs and don't spend enough time with you and don't answer your questions appropriately, or you decide not to take something that they prescribed and they said, well, if you're not going to take what I tell you, I'm not going to see you anymore. They aren't worth a hoot. I'll just tell you that straight up. You might want to fire them, and you have that right. That's what being in control of your health means. You set your own health goals. You decide what you want out of life. You get to make those decisions. Okay, I'll give you a simple example. It may sound stupid, but I'm not here to judge you. You might say, I like smoking cigarettes. I want to smoke cigarettes. It brings me peace and joy and happiness. Okay, well, as long as you understand that it can be and is a major contributor to the development of lung cancer, and you want to assume those risks, smoke away. But here's the caveat to that. If that were to happen, you can't blame the system and you can't blame the providers for not telling you the risks, okay? But it's your choice. You want to smoke? Smoke away. I'm not going to judge you. It's your life. It's your health. As long as you accept the consequences and the risks that come with it. That's key. I will help filter through the pseudoscience and misinformation. The internet is filled with this. There are so many people. You remember I showed you my credentials. I showed you my license. No one does that. I've not seen that yet. I hear a bunch of people spouting off all sorts of crappy information, wanting you to shoot this into your body, take this IV, all this kind of stuff. And guys, I want to tell you something. Once you stick something in your body, if you inject it or get it IV, it ain't coming out. If something's bad or tainted, it can be deadly. Look up New England Compounding Center. Go look up NECC and see what happened with that compounding pharmacy years ago. Take a look at some of that stuff. That'll make you a little queasy, okay? So be careful. I'm going to help you. I'm going to help you filter through all that garbage out there because I'm sick and tired of people being taken advantage of. Okay, and last but not least, together, through education and experience, we can improve our quality of life. So folks, we're in this together. Okay, each one of us has an hourglass of sand. Now, the problem is we don't know how many grains are left in it. So my suggestion is live in the day, live in the moment. Okay, don't worry about tomorrow. Focus on today, enjoy life today, set reasonable health goals. Okay, and we're gonna tackle this together. So I'm in it for the long haul, and I hope you are too. Remember, like, subscribe, share this to your friends because, like I said, I absolutely believe this is going to help a lot of people. And please don't forget, if you keep a medication list, I absolutely encourage you to subscribe to my med list. It will be a game changer for you. It's like the fire extinguisher in the house analogy. Why do you buy a fire extinguisher? Well, goodness, in case there's a fire in the house. All right. So same thing with this. You buy this, you may not need it until the time comes when you need it. You don't plan on there being a fire, right? You don't plan on having to go to the emergency room for a condition. But guess what? If you do, you're going to be so thankful that you have this. Okay. And I mean it from the bottom of my heart. All right, folks, that is it for me. I am so glad that you tuned in. Thank you so much. And I look forward to seeing you next time.
The troll drops